Disclaimer: this content is for informational purposes only and does not replace professional medical advice. If you have specific questions, consult a qualified doctor. Hello and welcome to Health Pills. Today, we're diving into an essential topic: understanding blood tests and why knowing how to read them could be a life-changing skill. Just as you wouldn't wait for your car to break down before taking it for maintenance, your body deserves proactive care to keep it running at its best. In this video, we'll explore the importance of preventive health, why baseline blood tests matter, common misconceptions about standard ranges, and the key markers that should be part of your routine checks. If you're looking to boost your knowledge and take charge of your health, stay tuned. 1. Preventive care for your body. Just as regular maintenance extends your car's life, adopting preventive measures can significantly enhance your health span, the part of life where you remain vibrant, active, and free of major health issues. Despite this, many people still adopt a reactive approach to health, acting only when problems become severe. This wait-and-see method often results in more suffering, higher costs, and reduced quality of life. By embracing proactive care, such as regular health checkups and mindful lifestyle adjustments, you can prevent the progression of conditions that might otherwise become chronic or life-threatening. It's not just about living longer, it's about living those extra years with vitality and joy. Taking charge of your health today means you could add decades of good, productive years to your life. Investing time in understanding your body's needs, listening to early signals it sends, can transform how you experience aging. Preventive actions include balanced nutrition, regular exercise, stress management, and timely medical assessments, like blood tests, to monitor underlying markers. These proactive strategies ensure that potential health problems are detected and managed early. They enable targeted interventions that can slow or even reverse developing health issues before they become more difficult to treat. Ultimately, thinking of your body as an invaluable vehicle that needs routine care helps change your approach, shifting the focus from crisis management to consistent well-being. 2. Why baselines matter. Imagine getting a phone call where the first question is, "Should I turn left or right?" without any clue where the caller is. The logical response is to ask for their current location before offering directions. This analogy applies to health. A blood test acts as your body's GPS, providing an essential baseline to guide your next steps. Without that baseline, it's challenging to make informed decisions or track your health journey over time. Baselines help set a standard against which future tests are measured, revealing trends that might indicate emerging problems before they become serious. For example, a slight but consistent increase in blood pressure or blood sugar over a few years is more meaningful than a single snapshot showing elevated levels. By understanding your baseline, you can address these shifts early. However, the value of this baseline depends on knowing what to look for and how to interpret it. Familiarity with your blood test results enables better conversations with healthcare professionals and more active participation in your health management. Your baseline isn't just a one-time data point. It's a dynamic record that evolves and provides insights as your health changes. Over time, these records can reveal patterns that predict future health concerns, allowing preventive actions. Ignoring this essential tool is akin to driving without a map. Eventually, you'll get lost, and finding your way back may be more complicated than necessary. 3. The basics of blood tests. One of the primary aspects of blood tests to understand is the diagnosis of anemia, a condition where the body lacks sufficient oxygen-carrying capacity. Hemoglobin is the most vital marker to evaluate in such cases because it directly relates to how well oxygen is transported in your blood. Adult males should ideally have hemoglobin levels between 14 and 16 grams per deciliter, while women may fall slightly lower due to natural differences in blood volume. If hemoglobin levels are not within this optimal range, other markers come into play. For instance, red blood cell count, hematocrit, and mean corpuscular volume, MCV, can help identify whether the anemia is due to low iron or other deficiencies. MCV provides insight into the size of red blood cells. Small cells usually indicate iron deficiency, while large cells may point to B vitamin deficiencies. High total iron binding capacity, TIBC, is another marker that shows how eager your body is to bind and utilize iron. A high TIBC paired with low hemoglobin typically signals an iron deficiency, prompting further investigation. Understanding these markers provides a clearer picture of how your body functions, ensuring that the cause of anemia is correctly identified and treated. This depth of knowledge allows you to go beyond merely addressing symptoms and move toward a more comprehensive approach to health maintenance. 4. Understanding iron and ferritin levels. When it comes to assessing iron levels in your body, ferritin is the go-to marker. Ferritin represents your iron stores and gives a more accurate picture of your iron status compared to hemoglobin alone. Despite its importance, ferritin is often neglected in standard blood panels. Low ferritin levels can indicate that your body is on the verge of developing anemia, particularly in women who menstruate regularly. This makes ferritin testing crucial for preemptive care. On the other side of the spectrum, men and postmenopausal women should be vigilant about high ferritin levels, as excess iron can accumulate in tissues and lead to a condition called hemochromatosis. This iron overload can damage organs, particularly the liver and pancreas, contributing to insulin resistance and metabolic issues. The significance of ferritin levels extends beyond anemia. They can also be an early warning sign of systemic inflammation or chronic illness. While low ferritin can signal that your iron reserves are depleted, high levels might indicate oxidative stress within the body. Understanding where your ferritin levels stand helps you tailor dietary and lifestyle changes to either boost or limit iron intake. This ensures that iron is maintained at optimal levels, balancing energy production, cognitive function, and overall health. Monitoring ferritin is a proactive step that offers a more complete view of your body's ability to handle stress, process nutrients, and maintain cellular health. 5. When markers don't align. There are cases where blood test markers don't align in the typical fashion, such as having low hemoglobin but high ferritin. This contradiction suggests that the issue isn't iron deficiency, but something else interfering with red blood cell production. Essential nutrients like B vitamins, specifically B6, B9, folate, and B12, play a significant role in creating healthy red blood cells. Deficiencies in these vitamins can result in a condition called megaloblastic anemia, where red blood cells are larger than normal but inefficient at carrying oxygen. MCV, which measures the size of red blood cells, can offer clues in such scenarios. Small red blood cells often indicate iron deficiency, while larger cells typically point to B vitamin deficiencies. Copper and zinc are other minerals that could be lacking if your hemoglobin is low but iron stores are sufficient. These minerals are involved in various enzymes that help produce red blood cells. Misaligned markers can also occur when inflammation is present in the body. Inflammatory conditions can cause iron to be stored and not utilized effectively, leading to functional anemia despite having adequate iron levels. Understanding these nuances allows for more targeted interventions. Rather than simply supplementing iron, which could exacerbate certain conditions, it's essential to identify the real cause and address it comprehensively for improved long-term health. 6. The problem with standard blood test ranges. Standard blood test ranges often reflect a bell curve distribution that includes 95% of the population, dismissing the lowest and highest 2.5% as outliers. While this may indicate normal, it doesn't equate to optimal. These ranges can be misleading as they are adjusted over time based on population health. As overall health declines, these ranges widen, allowing more people to fall within normal parameters despite underlying issues. For instance, the reference range for insulin can span from 2 to 25. While 2 is considered healthy, a level approaching 25 usually signals insulin resistance or prediabetes. Waiting until a marker hits an extreme range before taking action is akin to ignoring a slowly deflating tire until it's flat. Proactive health management focuses on catching subtle changes early. This approach can identify trends that signal potential problems years before they develop into chronic diseases. By understanding that normal isn't always optimal, you can take charge of your health. Early intervention with lifestyle changes and targeted nutritional strategies can maintain markers in an optimal range, preventing the need for reactive treatments. Knowing your own numbers and what they mean allows for informed conversations with your doctor, making healthcare a collaborative effort aimed at staying in the best possible range. 7. Why doctors miss important details. One significant issue in interpreting blood tests is that most doctors only look for flags, markers that are either too high or too low. This method ignores valuable data that could indicate health trends or potential problems. For example, if your cholesterol levels are within the standard range, they might be overlooked, even if they are steadily increasing year after year. This is similar to waiting until your car's check engine light comes on instead of noticing the subtle signs that something is amiss. The problem with focusing solely on flagged markers is that it leaves a lot of information untapped. Your blood test results are filled with insights that can help you prevent disease and maintain optimal health if you know how to interpret them. By not addressing non-flagged but suboptimal levels, doctors often miss the chance to recommend preventive measures. This can delay intervention until a condition becomes severe enough to trigger a flag, which is often too late for easy correction. Ideally, blood tests should be used as a proactive tool to monitor health, identify trends, and make adjustments before issues arise. A comprehensive approach to reading blood test results involves looking beyond just the highs and lows, focusing instead on the full picture to understand what your body is truly communicating. 8. Examples of misleading ranges. Some blood test ranges are not only broad but also misleading. Triglycerides, for example, have a range that goes from 0 to 149. While the upper limit makes sense, the lower end does not. Having 0 triglycerides isn't feasible as they are a primary fuel source for your body. Cholesterol is another area where mainstream guidelines don't align with emerging data. Many recommendations suggest a total cholesterol range of 100 to 199, implying that lower is always better. However, studies indicate that having total cholesterol between 200 and 250 can be optimal when other markers like triglycerides and insulin are within healthy limits. These misleading ranges can lead to unnecessary concern or complacency. For instance, if your cholesterol is 195, it may be marked as normal, but if your HDL, good cholesterol, is low and your triglycerides are high, you may still be at risk for heart disease. This shows that context matters more than any single number. Another problematic range is for LDL cholesterol, which lists 0 to 99 as acceptable. A level of 0 is neither achievable nor desirable, as LDL serves essential functions in the body, including hormone production and cell repair. Recognizing the flaws in standard ranges empowers you to question results and seek a more nuanced interpretation for better health outcomes. 9. Markers that should be standard but aren't. Despite the growing availability of comprehensive blood panels, some crucial markers still aren't included in routine tests. These overlooked markers can provide invaluable information for assessing your risk of various diseases and conditions. LDL particle count, for example, offers more insight than a simple LDL cholesterol measurement, as it reveals how many cholesterol particles are in your bloodstream, not just the total amount. A higher number of smaller LDL particles can indicate a higher risk for heart disease. The size of these particles is another critical measure, as smaller, denser particles are more likely to contribute to plaque formation in arteries. Ferritin, a marker for iron storage, is also frequently excluded from basic tests, despite its importance in diagnosing conditions like anemia or iron overload. Hemoglobin A1C, which represents your average blood sugar levels over 3 months, should be standard for identifying early signs of diabetes or blood sugar dysregulation, but it's still not as common as it should be. The thyroid is another often underchecked area. Most standard panels only measure TSH, thyroid-stimulating hormone, which doesn't provide the full picture. To truly understand thyroid function, it's crucial to also test T3, the active form of the thyroid hormone, and thyroid antibodies to rule out autoimmune conditions like Hashimoto's disease. These additional markers give a clearer view of your overall health and help you take preventive measures. 10. The importance of insulin and other key markers. Insulin is an often overlooked but essential marker in blood tests. It provides early warnings about metabolic issues long before blood glucose levels show abnormalities. High levels of insulin can indicate insulin resistance, a precursor to type 2 diabetes and a major player in metabolic syndrome. Unfortunately, insulin is frequently skipped in routine checks, with doctors focusing on glucose alone. By the time glucose levels rise, the underlying insulin problem may have been progressing for years. Testing for insulin, along with C-peptide, can give a more comprehensive understanding of your metabolic health. C-peptide is produced alongside insulin and has a longer half-life, making it a reliable marker for how much insulin your body is producing. Homocysteine is another critical marker that is often overlooked. Elevated homocysteine levels are associated with a higher risk of heart disease and can indicate poor B vitamin metabolism. Addressing high homocysteine is straightforward but requires awareness and testing. Vitamin D is crucial for immune function, bone health, and overall well-being, yet it's not always included in standard panels. Low vitamin D levels are linked to various chronic diseases, and it's easy to correct through supplementation. By understanding and requesting these important but often overlooked markers, you can get a more accurate picture of your health and take proactive measures to prevent potential issues. Conclusion. Remember, understanding your blood work isn't just about spotting red flags. It's about recognizing trends and making informed decisions to maintain your health at an optimal level. By looking beyond standard markers and learning what truly matters, you can take significant steps toward better health and a longer, more vibrant life. Thank you for watching Health Pills. If you found this video informative and want to learn more about how to take control of your health, don't forget to subscribe to the channel. Give this video a thumbs up and hit the notification bell to stay updated with our latest health insights. Take care and see you in the next video.